Hello, my name is Javier Guzman. In today's presentation, I will talk about the utilization of sexually transmitted infection screening via nucleic acid amplification testing for men who have sex with men while on HIV pre-exposure prophylaxis. The World Health Organization strongly recommends the use of PrEP in populations at substantial risk of HIV, particularly prioritizing MSM in all world regions. However, studies have shown an increase in STI infections among patients recently initiated on PrEP, attributed to condomless sex. Cases of reputable bacteria STIs, such as gonorrhea and chlamydia, have surged, with rates reaching all-time highs. During the literature review, a major obstacle was identified: the insufficient access to triple anatomical site sampling for STI testing. Additionally, the demand for active STI screening programs and the difficulty of MSM in disclosing sexual health information to their primary care providers were noted as barriers. My evidence-based practice proposal aims to utilize nucleic acid amplification testing for genital screening, focusing on pharyngeal and rectal swabs for MSM currently on PrEP to reduce STI infections and ensure comprehensive, safe screening during medical follow-up appointments. I plan to collaborate with Southwest Community Health Center and the Infection Department in Bridgeport, Connecticut, to implement this study. The theoretical framework for this study will be the health belief model, which plays a crucial role in understanding preventative health behaviors related to HIV and STI screening. The study will employ a quasi-experimental design with pre- and post-intervention data collection. Participants will include those newly on PrEP and those already on PrEP, with assessments conducted at two different time points to evaluate the impact of testing education intervention. Our sample, it will be convenience, 200 male participants. The inclusion criteria is men who have sex with men, currently on PrEP, over the age of 18 years old, who speaks English and or Spanish only. The exclusion criteria will be participants unwilling to sign the form consent and refusal of NAAT testing education, and participants who are on injectable PrEP. If the patient expressed interest in engaging with the study, they will be required to complete a brief questionnaire covering various topics such as their comfort level with testing, past experiences with swab tests, communication with healthcare providers about sexual health, and consent for rectal and oral swabs. These procedures will be carried out by trained medical staff at our clinic. Participants will have the opportunity to complete a follow-up survey at the 6-month mark to monitor changes behaviors related to testing and sexual health practices. The data collected will be used to propose evidence-based practices aimed at improving sexual health intervention. Data analysis will involve comparing pre- and post-assessment scores using the independent t-test method to determine significant differences and correlations between the two groups. The ultimate goal of this study is to enhance healthcare outcomes and management of STIs, particularly among high-risk populations. Clinical practice guidelines recommend routine screening of individuals engaging in high-risk behaviors for extragenital STIs, yet the rate of testing remains notably low in HIV clinics nationwide. However, the University of Washington, D.C. prevention training centers have successfully implemented a self-testing program at a large HIV primary clinic in Seattle, Washington. Despite initial concerns, the self-test implementation was met with positive acceptance from clinicians and nursing staff, proving effective in overcoming barriers through extragenital STI testing and ensuring enhanced patient care in the clinical settings. In terms of future research, there is a need to seriously consider the potential role of doxycycline as a preventative measure for chlamydia, both as pre-exposure prophylaxis and post-exposure prophylaxis. Our recent analysis reveals a concerning rise in STI cases among the MSM population, with suboptimal compliance with recommended screening regimens. Various barriers contribute to this trend, highlighting the lack of routine STI and NAAT testing for urethral and rectal swabs during follow-up appointments. Evidence-based findings consistently demonstrate that regular STI screenings not only reduce the incidence of new active diagnosis, but also effectively mitigate escalating STI rates. Thank you.